I'm Tanya Milstead, and I am in Jason Lankford's Biology 2401 class at Angelina College, and this is my extra credit, and I'm doing on the cranial nerves. And this is my husband, and this is the brain. We're going to test each nerve. We're going to do the function and where they're located at. The first nerve of the brain is the filaments of the olfactory nerve. Those are these right here. Function is purely sensory. It's the sense of smell. And to test it, you sniff a substance and identify. So we're going to have him sniff this and tell me what it is.
Coffee.
Okay. Now we're going to pretend like he has had some damage in this area of his brain. Okay. Now we're going to test him again and see if he can tell me what this is. Can you smell anything?
No smell.
Okay. So that is the olfactory. The second nerve is the optic nerve. The function is purely sensory. It has to do with your vision. To test, we do an eye chart, testing the pointing at which the person first sees the fingers enter the visual field. So we're going to do an eye chart, and he's going to read these.
A, B, C.
Okay, and you're going to tell me when you see my finger enter your eye field.
Now.
Okay, now we're going to pretend like he's had damage in that area of his brain. Can you read this for me? You don't know it? Okay. And tell me when you see my finger into your eye vision field.
Now.
Okay. So that is the optic nerve. The third one is the oculomotor. That's this area here. Primary function is the eyes and the eyelid. To test, we're going to examine the pupils for size, shape, and equality, and follow objects with his eyes. So we're going to examine his eye pupils. Okay, there's the same size and shape. They're equal to light. I want you to follow my highlighter with your eyes. Okay, good. Now we're going to pretend like he's had damage in this part of his brain. Okay, we're going to examine your eyes now. Okay, they're not equal. This one over here is now 4. This one is a 2. This one is shaped like a football. This one is round. I want you to follow my eyes with your highlighter, with the highlighter. Okay. That's the oculomotor nerve. Number 4 is the trochlear nerve. That's this one over here. Function is primarily motor, the muscles that move the eyeball. To test, we're going to examine the pupils for size, shape, and equality, and we're going to follow objects with the eyes. So we're going to examine the eyes. They're the same shape and size. They're equal. Now follow your eyes with the highlighter. Good. Now we're going to pretend like he's had damage in this part of his brain. Right, now we're going to examine his eyes again. Okay, now we have a 4 over here, a 2 over here, and this one is an irregular shape. Now follow the highlighter with your eyes. Okay, we've tested that area of the brain. Area number 5 is the trigeminal nerve. That is this area of the brain. Function is mixed. Sensory nerve of the face and the mouth. To test, we're going to do sensations of pain, sharp, hot, cold, clenching of his teeth, moving the jaw from side to side. Can you clench your teeth for me? Can you move your jaw from side to side? Okay. Can you tell me what this, if it's cold or hot?
Cold.
Okay. And tell me if you feel this pinprick.
Oh.
Okay. All right. Now we're going to pretend like he's had damage in that part of his brain. Can you clench your teeth for me? Can you move your jaw from side to side? Can you feel this at all? Can you feel it? Okay. And can you feel this pin prick? Didn't feel that? Okay. That's the trigeminal nerve. Number 6 is the abducens nerve. That's this area of the brain. Function is somatic motor fibers to the muscles that move the eyeball. We're going to examine the pupils again for size, shape, and equality. Follow objects with the eyes. Okay, his pupils are a 2. They're equal. Okay, follow the highlighter with your eyes. Okay, good. Now we're going to pretend like he's had damage in that part of his brain. Alright, we're going to examine his eyes now. Okay, we've got a 4 over here, a 2 over here, and this one's irregular shaped. Now follow the highlighter with your eyes. Alright. That is the 6th cranial nerve. 7 is the facial, and that happens to do with mixed facial expressions, salivary glands, and taste. And that is this one here. To test, we're going to taste sweet, salty. We're going to close our eyes, smile, and whistle. Alright. Can you tell me what this tastes like?
Sweet.
Okay. Can you tell me what this tastes like?
Salty.
Okay. Can you close your eyes tight? Can you smile? Alright, now we're going to pretend like he's had damage in this part of the brain. Okay. Can you close your eyes tight? Can you smile? Can you tell me what this tastes like? No taste?
No taste.
Okay, can you tell me what this tastes like?
No taste.
No taste. Number 8 is the vestibular cochlear. Function is purely sensory, having to do with the hearing. Testing is with a tuning fork, and this one has to do with this area of the brain. I don't have a tuning fork, so we're going to check with a bell. Tell me if you can hear this.
Mm-hmm.
Okay. Now we've had damage in that part of the brain, so we're going to check it again. Okay, now tell me if you can hear. Can you hear it? No? Okay. All right. Number 8 is number 9, glossopharyngeal. That is the brown. That's this part of the brain right here. Function is mixed pharyngeal muscles, tonsils, tongue, and pharynx. The way we're going to test it is with our gag reflex, swallowing, speaking, and coughing. Can you swallow for me? And can you cough? Okay. Now we're going to pretend like we've had damage in that part of the brain. Can you cough for me? Can you swallow? Okay. Number 10 is the vagus area. That is this part of the brain over here. Our function is pharynx and larynx. To test our gag reflex, swallowing, speaking, and coughing. Okay, can you swallow for me? Can you tell me what your name is?
Jason.
And can you cough? Okay, now we're going to pretend we've had damage in that part of the brain. Can you cough for me? Can you tell me your name? That's number 10. Number 11 is the accessory. That is mixed, the sternocleidomastoid, the trapezius medials. Testing is rotating the head, shrugging the shoulders against resistance. That is this area of the brain. Okay, can you turn your head from side to side? And can you shrug your shoulders against my hands? Okay. Now we're going to pretend we've got damage in that part of the brain. Can you turn your head from side to side? Can you shrug your shoulders? Okay. And that's number 11, the accessory. And number 12 is the hypoglycal function is motor fibers to muscles of the tongue, and that's for sticking out the tongue. So that's this area of the brain. Can you stick your tongue out for me? Okay. We're going to pretend like he's had damage in that part of the brain. Now can you stick out your tongue? Alright, that concludes my extra credit on the cranial nerves.